Thank you for joining us today. On this program, we have Todd Soura, a personal trainer with Action Personal Training, and Dr. Eric Kephart, physician at Kephart Integrative Medicine, discussing human growth hormone.
Hi, I'm Todd Soura with Action Personal Training. I'm the owner, and I'm sitting here with a friend of mine, Dr. Eric Kephart of Kephart Integrative Medicine. We're going to be trying to do this video about once every other week or so, and bringing up a different subject. Let Eric explain what he does.
Yeah, thanks, Todd. Eric Kephart. I'm a physician here practicing in Doylestown. We at Kephart Integrative Medicine, we utilize advanced treatment options to help our patients live healthy lifestyles. We do that through bioidentical hormone replacement therapy, genetic testing, medication, supplements, and we do regenerative medicine. That's injection with platelet-rich plasma, PRP, and that's a non-surgical option to help folks with chronic joint pain, osteoarthritis, or overuse injuries, previous injuries. Those are some of the options and services we offer here.
And how Eric and I met is through a shared patient client, and we realized we have a lot of similarities in the people we serve. And one thing I wanted to hit on today is one of the things our clientele is basically, in general, 45 years of age and older, people that are very interested in staying young, anti-aging, feeling healthy, quality of life. We're not looking to, at least our business, we're not looking to make supermodels and so forth in general. We just all want to feel good, stay young, be healthy. So one of the things I want to touch on, there's so many things, and we'll go over each every time we do this, we'll hit a new subject. But I want to touch base on growth hormone. I'm a 49-year-old guy here, and I've always been interested in this as I've aged. As a subject, I've heard many things about growth hormone, good, bad, indifferent, and I just want to get your opinion on growth hormone, the benefits of it used in the therapeutic way for basic quality of life, anti-aging, that type of thing.
Right. Yeah. Growth hormone is a fantastic hormone that, unfortunately, as we age, it decreases. It drops off real quick after about puberty. So actually, we live most of our life with lower value than we would wish we had. But growth hormone is a hormone that's released at the anterior pituitary in the brain, and it's really important for a lot of functions. As kids, it helps us grow, but as adults, we can use it, and it's released mainly at nighttime during the first sleep wake cycle. That's when we see the greatest release of it. And as I said, we lose that level as we age. And so what we want to do is see if we can replace that or reintroduce the value and the benefits that we get from growth hormone.
And correct me if I'm wrong here, the drop-off is fairly significant. Isn't it around the age of 30?
Yeah, it's really quick.
It's like this.
That curve goes almost straight down, and then it just levels out at like almost nothing until the end. And so like most of your life, you're without very much growth hormone, which is super important for so many aspects. In adults, probably the biggest thing that we see is we'd say that it restores normal body composition. What that really means is it'll decrease fat and increase your muscle mass. So the combination of those two things together has just far-reaching health benefits on every level and every system you can imagine. But in a very simple form, that's kind of what it does. It's also great for cognitive benefits, as we get older. We've seen studies that show that it increases, the performance on the mini-mental status exam for our elderly folks. It's really good for cardiovascular profile and the lipid profile. And like I said, with allowing for improvements in strength, it allows us to, our exercise capacity and our performance in activities and stuff is improved then too.
And how about I know one thing, I come across this too. We have 3 kids, crazy life, crazy hours in family and work. Does it help with just dealing with that stuff? Energy, focus.
Yeah,
so you just.
One of the other measures that is commonly cited with growth hormone is this elusive thing called quality of life. And that encompasses so many of those factors, all those things that you just said. It allows us to have a better restful sleep at night, which that in turn turns into recovery, so that then you can wake up ready for your day. And it does improve mood and has a psychological effect for us, as we age. That's really important. So it crosses the blood-brain barrier. So it gets to the brain. It's one of the hormones that does that. So it has its effect on the brain too. And we see that plays out really importantly as we age.
Yeah, and growth hormone is not a sex hormone, correct? Men and women both produce it. It's just as good for women as men.
That's correct. Yep, we see it just as important for both men and women, and its effects. There's no preference for one or the other. We see that with other hormones too. We often think of testosterone, which we're not talking about, but for men, but women also benefit from testosterone. The difference there is in the dosage. So all these hormones, we have to think about what they do for men and women. Growth hormone, good for both across the board.
Awesome. I know you and I have discussed this too when we were private. And I just wanted you stimulate growth hormone through peptides rather than artificial growth hormone. Can you explain what peptides are and why that's better than the artificial growth hormone?
Yeah. So growth hormone works by it's released from the anterior pituitary, but it has to be stimulated to release the growth hormone. We do that through what's called a releasing hormone. So growth hormone releasing hormone goes and it attaches to a receptor on the anterior pituitary and it says release growth hormone. That's how we get growth hormone in the body. And like I said, that happens mainly at night. That's the biggest surge of it. So what we can do is we could just give you growth hormone. That is an injection that is bypasses that system. So it'd be just giving you growth hormone. 2 things with that is very highly regulated by the FDA and the DEA. That is highly controlled. That is for specific growth hormone deficiencies, and mainly children that are not growing appropriately. So that has a very specific purpose and is controlled very well. Growth hormone releasing hormone works a little bit different, and I can give that. It still goes to the anterior pituitary and causes release of growth hormone, but it's in a controlled manner because it has to sit on a receptor site and then cause that release. It actually upregulates the growth hormone production, which we know is already down, and then it causes that release. We recommend it at night because that's when we see the greatest release of growth hormone. And we'll talk a little bit about how else you can release growth hormone, but that process gives us great control. We really don't see too high levels of growth hormone. To your point earlier, you're not going to become a world-class athlete by doing, growth hormone releasing hormone. It has its ability to release the growth hormone, but it's well controlled. So we reduce side effects. The FDA is very comfortable with us prescribing it because we don't have, because it's safe. And the other thing is the cost then. So the cost is dramatically different than actual growth hormone. It's much more reasonable that we can afford to use.
All right. So it sounds like you get the best of both worlds.
Yeah, it's great for me and it's just great for the patient. So, then we get the effect of growth hormone because it's naturally released from the anterior pituitary.
And what it does not affect what little growth hormone you're producing naturally anyway. Artificial may affect that if you would.
If you just gave growth hormone and bypassed that whole system, then the anterior pituitary would have no reason to ever release any growth hormone. It would never get a signal to. Growth hormone was already high in the body, and that's where it becomes a difficulty in controlling it. How much do you have? Do you have too much? You get in side effects. And then you get into other things, or are you not doing enough because it's not regulated?
So basically, this gives you similar effects without the side effects.
Yeah.
And with no the body.
Yeah. Yeah.
Awesome. Awesome. The last thing I just wanted to discuss is what are other ways of stimulating growth hormone besides the peptides, just natural ways to help people out?
Yeah, I think that we see a lot right now of, some commercials and some infomercials and things promoting growth hormone and also, testosterone. You see that. And sometimes I'm a little cautious with those supplement companies and stuff, what they're giving you and what you're going to get from that. Sometimes they may be less regulated. So those type of things, it can, if you have good products. The one thing that I know, and it's been proven through studies, that has definitely shown elevated growth hormone levels naturally, is resistance training. And so we have study after study says resistance training, after a resistance training workout, after that period of time, you can check the growth hormone levels and they have elevated, they've gone up. So resistance training is anything, it's body weight, could be resistance bands, dumbbells, your weights, whatever, that you do with clients all the time.
Yeah.
That elevates growth hormone, and that's natural, and so that's a great way. And as we see that elevated growth hormone, that in turn allows increased exercise capacity. So then that translates into both aerobic and anaerobic work. So your walk or your jog or your cycling, then you'll have increased capacity to do that. And it just kind of builds on itself a little bit. You can upregulate all this. And that's probably, those are the best ways of naturally elevating your growth hormone level.
Awesome. Awesome. This is great. I think think it's very informative. And again, I'm looking forward to doing this more often, and so many subjects I want to speak of, everything from vitamins, vitamin D, to testosterone replacement, to helping with injuries. Many people that, tendons get old or worn, and how we can fix those. So I'm looking forward to that. Eric here, he's located in Doylestown. I'll have you give your information.
We're in Doylestown at Hyde Park, at 403 Hyde Park. Right now with everything, we're doing telemedicine a lot too, with both the genetic testing. The growth hormone can be via telemedicine services, and our BHRTs. We're open for PRP injections. We do them on a very controlled basis, having people in here to be safe with the current situations. Our phone is 267-406-4083 if you want to contact us, and we'd love to talk to you.
Awesome. And again, this is Todd Soura with Action Personal Training. We do in-home personal training and fitness training for businesses as well as individuals. And we'll have our information up on the screen as well. All right. Thanks, Eric.
Thanks, Todd.
All right.